Person-centered care is a care approach that considers the whole person, not just their physical and medical needs. It also refers to a person's autonomy to make decisions about their care, as well as participate in their own care. This approach improves health outcomes of individuals and their families as care is provided according to the residents' preferences, choices, and habits held before they required assistance to care for themselves. The term person acknowledges a human being has rights. It also recognizes that a person is a human being who is made of several human dimensions. These dimensions include intellectual, environmental, spiritual, socio-cultural, emotional, and physical, all of which operate together to form the whole person. In providing person-centered care, healthcare professionals consider all these elements while meeting healthcare needs. A nurse aide can focus on an individual's personhood by spending time communicating with them and finding out what interests them. What is important to them? What concerns them? And what causes them to feel unsafe? It also includes asking each person how they would like to be addressed, as well as avoiding demeaning terms like honey, sweetie, or sweetheart. Promote their dignity by using age-appropriate words and avoiding words like diaper, bib, potty, or feeders. The vital element of person-centered care is effective communication between the healthcare provider, the client, and the client's family members or significant others. Effective communication facilitates information sharing and trust. When a nursing assistant helps clients with their ADLs, person-centered care means learning clients' personal preferences and routines. Examples of using the person-centered care approach are knowing the time the resident prefers to wake up and go to bed, their preference for showers, tubs, or bed baths, their preferred arrangement of their belongings, and their mobility issues. Cares are individualized based on these preferences. Respecting residents' dignity and privacy is demonstrated by keeping them covered and warm when bathing, explaining procedures prior to doing them, and protecting their health information. It also means respecting personal beliefs, being aware of cultural differences, and offering choices and options when available. It is important to remember that it is often difficult for clients to feel dependent on others to provide their personal care. Nursing assistants must demonstrate empathy with clients, especially with those who are experiencing the loss of their independence. Caregivers should allow residents to do as much as possible for themselves, under appropriate supervision, while providing assistance as needed. Allow them to make decisions about their care and encourage them to perform as much self-care as possible to promote their independence, self-esteem, and sense of control over their care. An added physical benefit of encouraging residents to perform self-care is it maintains their strength and mobility, thereby preventing a decline in physical function for as long as possible. Listen to this scenario and decide what Maggie should do. She remembers learning about person-centered care during her CNA courses. Maggie works hard to take into account all dimensions of the person. One day, Maggie is assigned to care for Mr. Johansson, a 75-year-old man who has been living at the nursing home for several months. Mr. Johansson is able to perform most of his activities of daily living, ADLs, independently, but he sometimes needs assistance with bathing and getting dressed. Maggie notices that Mr. Johansson seems a bit down lately, and he hasn't been participating in the nursing home's activities as much as he used to. When tidying his room, she notices a photo of Mr. Johansson holding up a really big fish next to a young man and a toddler. All three are smiling ear to ear. Then she notices that one of his baseball caps says "World's Greatest Fisherman" on it. What could Maggie do to help Mr. Johansson? Possible answers: she could talk to him about his interests and hobbies. Using the observations she made about the picture and the baseball hat, she could figure out if Mr. Johansson likes to fish. If he does, she could arrange for him to meet and connect with other residents that like to fish or participate in a fishing activity. Maggie should continue to provide person-centered care to Mr. Johansson by encouraging him to do things that make him happy and helping him maintain his independence as much as possible.